How to stop your dog from trying to bite the vet. To stop your dog from trying to bite the vet, you will need to take a multifaceted approach and tackle the issue from various angles. Following are several general tips to ameliorate the situation, but it's important that you seek professional help for safety and the correct implementation of behavior modification. 1. Address medical problems. If your dog tried to bite your vet because he was in pain, it's important to first ensure that the underlying medical cause of the pain is addressed. Discuss pain control and steps you can take to reduce further instances of this mishap with your vet. If your dog tried to bite because he was in pain, there are chances that his incentive to bite will fade once the source of the pain is addressed. 2. Prevent rehearsal of the problematic behavior. As mentioned earlier, when dogs try to bite, there's often an element of negative reinforcement at play. The dog is able to get out of an uncomfortable situation and also gets to vent his negative feelings. This causes dogs to want to adopt this strategy more and more in the future. Not to mention, when dogs are put into situations where they feel uncomfortable and fear for their lives, this causes them significant stress. Therefore, it's important to take steps to prevent dogs from being put into such intense situations, at least until you can work on the problem behavior and teach your dog better coping skills. 3. Muzzle train your dog. All dogs should be trained to wear a muzzle and form positive associations with wearing it from an early age, no matter how mellow your dog is. Any dog can bite when put into a scary or painful situation. This is even more urgent in a dog who has already tried to bite somebody. Make sure to use a bite-proof muzzle for extra safety. You will still be able to feed treats through basket muzzles. You will need to teach your dog to wear a muzzle in a positive manner, taking your time and ensuring your dog is comfortable. Here is a guide for teaching your dog to wear a muzzle. Aim for a positive, conditioned emotional response. It's important to emphasize that just because your dog is wearing a muzzle doesn't mean he should be put into overwhelming situations. A muzzle should just be used to offer an extra layer of protection during behavior modification sessions. 4. Identify your dog's triggers. It's important to identify what your dog struggles with when going to the vet. Think back on what happened right before your dog tried to bite. Was the vet handling his paws? Was he inspecting his ears? Was he closely looking into his eyes using an ophthalmoscope? Was he lifting his paws? This information can provide you with hints of what your dog is particularly struggling with so that you know what you will need to mostly work on. In some cases, there may be multiple triggers at play that will need to be addressed individually before being combined. If your dog was in pain, consider that he may no longer feel the need to bite once the pain is addressed. However, it may still be worth working on the issue to reduce the potential onset of fear memories. 5. Use desensitization and counter-conditioning. Once you have recognized your dog's triggers, you can start working on making them less concerning and even becoming a predictor of good things. This can be done through the combined use of desensitization and counter-conditioning. Desensitization is a behavior modification method that aims to expose dogs to their triggers, starting at lower levels of intensity. Such low-level exposures allow dogs to be under threshold, providing them with an opportunity to learn how to better cope with their triggers. Counter-conditioning is a behavior modification method that aims to create positive associations with triggers. These positive associations are often attained through the use of high-value treats. For example, if your dog is normally okay with your vet until the vet tries to lift his paws, you know that you'll need to work on making those paw lifts less concerning. With your dog wearing a muzzle, you can then start working, along with the help of a professional, on just moving a hand towards the dog's paw and feeding a treat. After doing several reps of this, you would then raise the criteria and move on to barely touching the paw and feeding a treat. Once the dog is fine with this, you can then touch the paw more and feed a treat. After several reps of this, you can then start lifting the paw half an inch and feed a treat. Then you lift it a little more and more, working towards lifting the paw and inspecting it as your dog is fed several treats in a row. Once interaction with the paws stops, feeding also abruptly stops. Paw touching needs to become a predictor of good things. If your dog ever shows signs of feeling uncomfortable, take that as a sign that you have moved through the process too quickly and need to take the process a few steps back before moving forward again. Afterward, the same exercise can be practiced with volunteers and then finally at the vet's office while always feeding the dog treats during the examination. 6. Familiarize your dog with the vet and office. It's important to help familiarize your dog with the vet and their office. Don't just take your dog there for visits. Every now and then, swing by to just say hello to staff and give him treats. Feed your dog treats for stepping on the scale. Have him visit an exam room where a staff member feeds him treats. Let him feel more comfortable going there. And also remember to act confident and happy so your dog senses all these positive emotions exuding from you. 7. Work along with a professional to ensure everybody stays safe, and for the correct implementation of behavior modification, it is important that you work alongside a professional using force-free behavior modification techniques. Your best bet is to work with a board-certified veterinary behaviorist or a certified applied animal behaviorist. Alternatively, you can work with a dog trainer or behavior consultant who also uses force-free methods and is comfortable with working on dog fear and potential aggression. 8. Pick a fear-free practice. Did you know that nowadays there are more and more fear-free practices? The fear-free movement has been crafted with fearful dogs in mind. Fear-free veterinarians are specifically trained to provide veterinary care to dogs who manifest fear, anxiety, and stress. They implement strategies to ensure a positive experience so as to reduce any potential fear or discomfort associated with veterinary visits. Offering high-value food or toys throughout the visit can promote security and, ideally, positive associations. Desensitization and counter-conditioning are highly recommended, both to prevent and address existing negative emotions. Thank you for watching this video. Please subscribe, comment, like, and share the video.